Dennis Quaid and Kimberly Buffington were overjoyed as they welcomed their twins, Thomas Boone and Zoe Grace, into the world. On November 8, 2007, these tiny miracles, born prematurely, were placed under the watchful care of Cedars-Sinai Medical Center. The hospital, renowned for its excellence, seemed like the safest place for these fragile newborns. But then, something terrifying happened. As the nurses tended to the twins, a sudden and alarming sign appeared. Both infants began bleeding excessively from their tiny puncture wounds. What should have been a routine procedure was now spiraling into a medical emergency. The joy that had filled the Quaid family's hearts was quickly overshadowed by fear and uncertainty. Why were these tiny newborns bleeding so much? What could possibly cause such a sudden and severe reaction? And how did things escalate so quickly from routine care to a life-threatening situation? Dennis Quaid was a celebrated Hollywood actor. He and his wife, Kimberly Buffington, were living what many would consider a dream life. Weeks earlier, the couple had welcomed their twins, Thomas Boone and Zoe Grace, into the world. On November 8, 2007. The twins were, however, born premature and required specialized medical attention right from the start. Their premature birth presented a range of complications: underdeveloped organs, difficulty maintaining body temperature, and a high susceptibility to infections, all of which necessitated round-the-clock intensive care and constant monitoring. Given these challenges, the Quaid twins were admitted to Cedars-Sinai Medical Center in Los Angeles, one of the most prestigious hospitals in the country, renowned for its neonatal care. Despite their reputation, the twins' delicate condition demanded more than just routine care. It required vigilant, precise medical interventions to ensure their survival. The medical team at Cedars-Sinai placed the twins in the Neonatal Intensive Care Unit, NICU, where they were kept under strict observation, connected to various machines and devices that monitored their vital signs and provided essential life-sustaining treatments. One of the critical aspects of their care involved the use of intravenous catheters, which are thin, flexible tubes inserted into a vein. These catheters play a crucial role in neonatal care, allowing healthcare professionals to administer fluids, medications, and nutrients directly into the bloodstream. Given the twins' premature state, their veins were particularly fragile, making the proper administration of these fluids and medications even more critical. The medical staff needed to ensure that the catheters remained clear of clots, which could impede the flow of fluids or medications. To prevent such clots from forming, an anticoagulant known as heparin was used to flush the catheters regularly. Heparin is a commonly used blood thinner that prevents blood from clotting in the catheters, ensuring that they remain open and functional. However, heparin is also a potent drug, particularly in high concentrations. In neonatal care, where patients are extremely small and vulnerable, the margin for error with medication dosages is minimal. Even a slight overdose can lead to serious, life-threatening complications. Tragically, the hospital staff made a critical error that turned this routine procedure into a potentially fatal one. The vials of heparin used to flush the twins' catheters were mislabeled, or more accurately, the different dosages were packaged in such a similar manner that it became easy to confuse them. In a busy hospital environment, where staff must make rapid decisions and carry out numerous procedures under pressure, such packaging similarities can be disastrous. Instead of receiving the low concentration of heparin, 10 units per milliliter, which is appropriate for infants and used to flush catheters safely, the twins were mistakenly administered a much higher concentration, 10,000 units per milliliter. This dosage, designed for adult patients who require a significant anticoagulant effect, is extremely potent. For the tiny bodies of Thomas and Zoe, this massive overdose posed an immediate and severe risk. The administration of such a high dose of heparin led to a situation where the twins' blood became too thin, preventing it from clotting normally. This condition, known as heparin-induced hemorrhage, can cause excessive bleeding even from the smallest injury or puncture, such as those caused by needles or IV lines. The overdose transformed what should have been a simple, routine procedure into a life-threatening emergency, placing the twins on the brink of a catastrophic medical crisis. The realization of the overdose struck the medical team at Cedars-Sinai Medical Center like a bolt of lightning. Initially, what had been perceived as a routine procedure for the Quaid twins rapidly devolved into a life-threatening crisis. The first alarming sign came when the staff noticed that both Thomas Boone and Zoe Grace were bleeding excessively from the sites where they had been pricked or had catheters inserted. For infants, even the smallest wounds typically clot quickly, so this abnormal bleeding was a clear red flag that something was terribly wrong. As the situation escalated, the medical team scrambled to identify the cause of the bleeding. The atmosphere in the neonatal unit, normally a place of quiet vigilance, would have shifted to one of urgent concern as the healthcare providers worked to pinpoint the issue. In a hospital setting where every second counts, the realization that the twins had been given 1,000 times the intended dose of heparin, a potent anticoagulant, must have been nothing short of chilling. The knowledge that this overdose could lead to severe internal bleeding, organ failure, or even death would have set off alarms, both literally and figuratively, throughout the unit. The medical team immediately initiated emergency procedures to counteract the overdose. Their first line of defense was protamine, a drug that neutralizes heparin's effects by binding to it and forming a stable complex that eliminates its anticoagulant properties. However, administering protamine in such a delicate situation was fraught with its own risks. In neonates, particularly those as fragile as the Quaid twins, the balance between neutralizing the heparin and avoiding potential side effects like excessive clotting was precarious. The dose of protamine had to be carefully calculated, and its administration had to be meticulously monitored. Despite the quick and decisive actions of the medical staff, the Quaid twins remained in critical condition. Over the following hours and days, they were under constant surveillance. Their vital signs were closely monitored, with any fluctuations potentially indicating further complications from the overdose. The medical team had to remain vigilant, knowing that any misstep could tip the balance from recovery to catastrophe. Meanwhile, the emotional toll on Dennis Quaid and Kimberly Buffington was immense. Informed of the incident, they were plunged into a state of shock and fear. The reality that their newborns had come so close to death due to a preventable error was devastating. For any parent, the prospect of losing a child is unbearable, but to have that fear realized because of a mistake, especially in a place where their children were supposed to be safe, was an overwhelming blow. The hospital staff, too, were acutely aware of the gravity of the situation. Cedars-Sinai Medical Center, a prestigious institution known for its excellence, was now facing the fallout from a serious error that pointed to deeper systemic failures. The incident raised immediate and pressing questions about the adequacy of the hospital's training, oversight, and safety protocols, particularly concerning the administration of high-risk drugs like heparin. The hospital's immediate response involved not just treating the twins, but also conducting an internal investigation to understand how such a catastrophic mistake could have occurred. This investigation likely involved a thorough review of all relevant procedures, from the storage and handling of medications to the verification processes that should have caught the error before it reached the patients. The goal was not only to prevent a recurrence of this specific error, but also to identify and rectify any underlying issues that might lead to similar mistakes in the future. On the other hand, the Quaids, reeling from the near-tragic overdose that endangered their newborn twins, chose to channel their anguish and fear into decisive legal action. Their primary goal was not financial compensation, but to hold accountable those whose actions or inactions had led to the near-fatal error. The Quaids were determined to prevent similar incidents from happening to others, and their lawsuit was a means to bring about systemic change. Their decision to file a lawsuit was strategic. Rather than targeting Cedars-Sinai Medical Center or the medical staff directly involved in administering the overdose, the The Quaids aimed their legal efforts at Baxter Healthcare, the pharmaceutical company responsible for manufacturing the heparin vials. The focus of their lawsuit was on the packaging of the drug, which they argued was dangerously similar across different concentrations, leading to the life-threatening mix-up. The Quaid lawsuit emphasized several critical points. 1. Packaging similarities. The vials for the 10,000 units per milliliter and 10 units per milliliter concentrations of heparin were virtually identical, both featuring blue backgrounds and similar labeling. The only distinguishing feature was the small print indicating the concentration, which could easily be overlooked, particularly in the high-pressure environment of a hospital. The Quaids argued that such packaging presented an unreasonable risk, as it made it far too easy for healthcare professionals to confuse the two vastly different dosages. 2. High-risk medication. Heparin is classified as a high-alert medication due to its significant potential for harm when used incorrectly. The Quaids contended that Baxter Healthcare, aware of this risk, should have implemented more rigorous safety measures in the packaging of heparin. They proposed that different colors, shapes, or sizes for the vials could have made the different concentrations more easily distinguishable, thereby preventing such errors. 3. Precedent for similar errors. The Quaids' legal team highlighted past incidents where similar packaging issues had resulted in fatal mistakes. One particularly tragic case involved 3 infants in an Indianapolis hospital who died after receiving the wrong dose of heparin due to a mix-up similar to what happened to the Quaid twins. Despite these known risks, the lawsuit argued, Baxter had failed to take adequate steps to modify the packaging of their product to prevent such errors from recurring. 4. Preventable tragedy. Central to the lawsuit was the argument that the overdose was entirely preventable. The Quaids maintained that if Baxter Healthcare had exercised due diligence in addressing the known risks associated with their product's packaging, the near-fatal mistake could have been avoided. Their legal action aimed to compel the pharmaceutical industry to adopt better safety standards, ensuring that no other family would have to endure the trauma they experienced. The Quaids sought only $50,000 in damages, a modest sum that underscored their true intent. They did not pursue the lawsuit for monetary gain. Rather, their goal was to draw attention to the critical issue of medication safety and to drive meaningful change in the industry. By keeping the financial aspect of the lawsuit minimal, they highlighted the genuine urgency of their cause. Furthermore, shortly after the incident in 2008, the Quaids established the Quaid Foundation, a non-profit organization dedicated to raising awareness about medical errors and promoting patient safety. The Foundation's mission was to advocate for systemic changes in hospitals and the pharmaceutical industry, focusing on the implementation of technological solutions to minimize human error. One of the key initiatives promoted by the Quaid Foundation was the adoption of barcoding systems in hospitals. These systems would involve scanning both the patient's wristband and the medication to ensure that the correct drug and dosage are administered. The Foundation pushed for hospitals nationwide to adopt these systems, which have been shown to significantly reduce medication errors. Dennis Quaid became a vocal advocate for patient safety, using his platform as a celebrity to draw attention to the issue. He spoke at numerous conferences, participated in public forums, and gave interviews to raise awareness about the dangers of medical errors. His advocacy was not limited to the United States. Quaid also worked with international organizations to promote patient safety on a global scale. One of the most impactful projects Quaid was involved in was narrating the documentary series Chasing Zero, Winning the War on Healthcare Harm. This series, produced in collaboration with the Texas Medical Institute of Technology, TMIT, explored the causes and consequences of medical errors and highlighted the stories of patients and families affected by these errors. The documentary aimed to educate healthcare providers and the public about the importance of preventing medical harm and promoting a culture of safety in healthcare settings. The Quaid's advocacy efforts also extended to the legislative arena. They worked with lawmakers to push for stronger regulations and oversight of the healthcare and pharmaceutical industries. Their efforts contributed to the passage of legislation aimed at improving patient safety, such as the National Quality Forum Safe Practices for Better Healthcare, which outlines steps that hospitals can take to reduce the risk of medical errors. The Quaid case also prompted hospitals and healthcare providers across the country to reevaluate their own safety protocols and implement stricter measures to prevent medication errors. Some hospitals began adopting the barcoding systems that the Quaid Foundation advocated for, while others increased their focus on staff training and education to ensure that such mistakes would not occur again. Baxter Healthcare, in response to the lawsuit and the widespread public outcry, also issued a safety alert to healthcare providers. This alert warned of the potential for confusion between the different concentrations of heparin. However, critics argued that this response was too little, too late, and that more substantial changes were needed to prevent future errors. As of now, Thomas Boone and Zoe Grace Quaid are thriving teenagers living healthy, normal lives after their near-death experience as infants. If you're interested in more stories like this, be sure to like, share, and subscribe. Also, comment down below if there's any particular case you'd like us to cover next.